A new drug is being blamed for turning parts of Philadelphia into what some are calling zombie land. Okay, you have seen the video of this. First it was heroin, then it was fentanyl and tranq. Now a new compound called medetomidine. Doctor, you schooled me in the commercial. I think I got it. Medetomidine is flooding Kensington Avenue, the city's notorious open-air drug market. Health officials and first responders say it's producing even more extreme sedation and brutal crashes than what came before. Anything more than what we've seen. A new piece highlights the intense effects of this drug. Quote, there are no stages to the high. And this is from Tony. You go straight to sleep. You do it, you wake up, you're sick. That's from Christine. You don't even know you're passing out. The article goes on to say, this isn't like nodding off. Along Kensington Avenue, people shuffle in near catatonic states, bent at right angles, some frozen mid-stride. Meanwhile, a biotech company is working on a vaccine that would blunt the effects of another powerful drug, fentanyl. The company hopes to start testing that soon with the goal of preventing overdose deaths. All right, I want to take this in pieces. Let's start with this first drug. And I mean, if you're at angle, you do look like a zombie. What is happening to the brain?
This is a drug called medetomidine, as you said, that's 100 times more powerful than tranq, xylazine. Everybody knows about tranq. They've heard about that. It's very sedating, and it lowers your heart rate and blood pressure. This is 100 times more powerful. So if you think what's happening, you're completely out of it. What I'm worried about is two things. One, it's laced with fentanyl all the time. So you're out of it, and then fentanyl causes you to stop breathing, or the medetomidine stops your heart or lowers your heart rate or lowers your blood pressure, and you go and you die. This together, and Narcan, which works against fentanyl temporarily, doesn't work against this. So you need a totally different antidote. Right. It's almost like an emergency responder has to come with a huge kit of antidotes now. Horrible.
Cheryl, you know what it's not almost, but exactly like? Oh, somebody, I bet, in some industry thought, well, if we put something out there that Narcan can't fix, maybe we'll need a new fix for this.
Yeah, it's called China. You might have heard of them. They're the ones that are sending all the chemicals that create fentanyl, filter it through Mexico. It was coming through the open border. That has stopped now, but we've got to make sure that it doesn't come back. And that's another, I guess, topic of discussion. But as far as this vaccine that you mentioned for fentanyl. Yeah. That, I think, is fascinating. This is from, it's a collaboration of University of Houston and Tulane University. And basically, it is a vaccine that you would be given to where if fentanyl were to ever, say, accidentally come into your system, which we know many deaths in the United States have happened. Kids didn't know that whatever they were smoking was laced with fentanyl and they died.
But they were tampering with something that they were perhaps not supposed to have.
Of course, yeah. But at the same time, they did not mean to ingest fentanyl,
right.
And there you go, pass away. So the fact that this could be a vaccine that could be given to people in your body, you would never get the high, apparently, from what the researchers say, you would never get the high of fentanyl because it would never get to your brain. Your body would never connect to it. I thought that was so fascinating.
So can that stop the addiction? Like, is it more than a vaccine? Does it help? Because if your brain's not feeling the effects of fentanyl, maybe you won't want it. Does that help?
That's absolutely true. And the way this works is it primes the immune system. It alerts the immune system to fentanyl before it's even in the body. So the immune system makes antibodies against fentanyl. And then when fentanyl comes in, it destroys it. It doesn't get to your brain. You don't get any.
But everybody doesn't need to take this.
No, this is for people at risk. So, Cheryl, this is for people that you think are at risk. Some people, medical professionals have said to me, warning, we still use this medically. So you don't want to give this to everybody in the population.
Lisa is my friend with the most questions on vaccines.
I love that Karis can already sense me, like, asking.
Here she comes.
Well, I know that Narcan has played a huge role in saving lives from fentanyl overdoses and in preventing, the loss of life with that. The thing I find interesting about this vaccine, and I'm unsure about, is it's preemptive. So are we then encouraging people to then go out and try fentanyl, right? Because they think they're safe. I mean, I don't know. I just kind of think it's strange that it's a preemptive thing versus when you have Narcan, which I fully believe in, having it more widely spread and available.
2 points about that.
Yeah.
One, I don't want the whole population getting this. Two, Narcan wears off, and the fentanyl doesn't. It takes days, so that's the danger, and that leads to the overdose. But they also are making a version, for people who are a little wary of vaccines, where you literally could inject the antibodies. You don't have to get the vaccine. You could get the antibodies instead, like we did with COVID. People that didn't want the vaccine got COVID, got the antibodies. They helped a lot. So I think this is a great vaccine, but I also like the antibodies, and it's not for everyone.
Are they both readily available then once the vaccine comes onto market?
They will be. They'll
Okay,
come out at the same
interesting.
time.
I totally agree with Lisa's point. I think the other part of the problem here, though, is that these drugs are making their way into the homes of people that you don't necessarily think are going to be affected. I think it would be really easy to chalk this up to, oh, it's Skid Row in LA, or it's this particular part of Philadelphia, or it's Portland. But these are all over the Midwest where I'm from. You know, my husband's from rural Ohio. Everyone there has a story of someone who has been severely affected by addiction or by overdoses. And a lot of these kids are getting fentanyl through other drugs because they're laced with fentanyl. And it's only a matter of time before this other drug starts to make its way into their system as well. So that's the really devastating part of this, is they're coming for people that you wouldn't think would necessarily be most affected.
You know, Lisa's point is great because you could say, oh, I'll take that vaccine. Meanwhile, you might be dead before then, right? I mean, you might get overdosed from the fentanyl before you ever get to anybody.
So how do you balance then prevention with what Lisa is saying, where you don't want to encourage people to then go out and do harder drugs because they think they're not going to necessarily be affected because they took the vaccine?
But the vaccine, though, technology, you don't get the high of the fentanyl
Right.
at all. It doesn't have any effect on you. I think that's the fascinating part. So whether it was accidental or you tried it on purpose, it doesn't hit your system.
What I hear Kaylee and Lisa, though, bringing about, and you know this is true, nobody's going to read the fine print necessarily on that. They're hoping that if they take fentanyl, you know, they'll still get some relief, but that the vaccine will protect them from the bad parts.
That's what they think.
Yeah.
But the reality is they won't get the high. And Cheryl, your point, China's busy flooding the market. So
It's big business for the Chinese.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.